Good morning. This is Dr. Timothy Scott Beck, and it's Monday morning. It is November the 7th of 2022, and I want to say good morning to you and let you know that we are open, and I've got 4 people answering the phones. So hopefully if you've got a problem, we can get a hold of us and we'll get you taken care of in a timely manner. Alrighty, so let's go ahead and talk about some important things going on. The first one that I want to talk about is tomorrow. Okay. Tomorrow is voting day. I went ahead and early voted, but I think I was raised from a childhood and as an adult to always consider voting to be a special right, something that we've fought for to maintain a legitimate voting system, and I hope it's still that way. Okay, but I definitely want everybody to do their part and show up and vote. It is our country. Let's just look after each other and do what we think. And mind you, I'm not telling you how to vote. I'm just saying let's vote. Let's figure out what's the consensus says about our community and how things are going, and go from there. So my request is, if you're of voting age, go and vote and do your best. And I thank you in advance for that. Let's talk about here. One of the things that I see going on here in the office seems to be pretty consistent, and I think it's my fault. It's the Women's Center, where it's located. The Women's Center is located actually on the other side of my building, the back side over by Reeves Feed and Tractor Supply. So anyway, if you come over here and you're scheduled in the women's clinic for a wellness or for a specific women's issue, you can park at the other side of the building over there. There's plenty of parking over there. Now, we don't care if you park on the other side. We'll escort you over there to the women's side, but we do realize that it's a little confusing. And there's a sign over there now. I put one up, but it's on the other side of the building from where the front entrance is. So you're welcome to go over there and use that. We'll have a receptionist and everything over there for that. It's not a big deal though if you don't. If you show up over on our side, we'll get you taken care of. Okay. And remember, we've kind of sequestered the Women's Center as something specifically for women. I go over there occasionally, but not a lot. Mainly when there's any kind of complication or something, they need me to go over there and look in on something that's going on. Okay. However, it is not separate. In other words, you're not chained to the women's clinic. You're not chained to the primary clinic here as far as getting health care. Okay. You can use both sides. The only thing is Monique is over there, and her passion in life is doing specifically women's health. And that's great with me because I want to make sure it's done, and I want to make sure it's done in a professional manner. And that's what she does over there. Okay. But you have access to both sides if you need it. Okay. Let's talk about refills. I've harped on you guys a lot about, bringing your meds for the visit. So one of the advantages of when you bring your meds to the visit is the nurses will go through and identify anybody who needs refills, and we'll automatically refill them for you. And we have a criteria that we do for that. But let me tell you what I do. When I prescribe people medicine, if it's a maintenance medication, something that you're going to be on all the time, and it's not that dangerous, and you've been on it for years, every time I write a prescription, I'm going to give you 90 days with 3 refills. That's a year's supply. So you don't have to call us back about that medicine for a whole nother year. Okay, and I do that on purpose because I don't want people having to worry about their meds. And I don't want people to have to worry us with getting their meds if there's no clinical judgment related to it. Okay, so if it's just something you need to be on, you've been on and you're stable, we're going to give you a year's supply. Now, there's some caveats to that. I don't give controlled substances out for a year because that's not appropriate, and that would not work in our community. And it's against the law too. And then sometimes if I give a med that is particularly dangerous, or it can have some adverse reactions, or if there's any issues with it, I'm going to do close follow-up with it. And I may limit the quantity of supply there because I want the patient to come back and talk to me before we continue that medicine to make sure that everything's going the way it should be. Okay, so there is sometimes we give limited prescriptions, but most of the time we give you a year's supply because that's what we want you to have, and we don't want you struggling to get your medicines or just stay on your medicines. And so we'll do that for you. If you've got refills, you usually don't have to contact us. Now, we do have Martine here, who is an RN that's in charge of our chronic care management program, and she'll handle most of your refills if you need them, if you're a member of the chronic care management program, which I highly suggest that you be a part of if you're Medicare age. Okay. But again, we always give enough so that you don't have the possibility of running out. Okay. Well, we're open this whole week. It's going to be a beautiful week, it looks like, and we want to hear from you if you're having any problems. Place of Hope is working steadily at doing what they do, and thank you for that, because I think you've all helped us with that. And we're happy to be here. We're happy to be alive. We want you to hear from you if you need help. Otherwise, have a great week, and talk to you next week.